Every year, millions of seniors are affected by strokes, a medical emergency that can change lives in an instant. But did you know that many strokes can be prevented or their impact greatly reduced simply by recognizing the warning signs early? Understanding these signs is one of the most important things you can do for your health or for the well-being of a loved one. Today, let's talk about 5 early warning signs of stroke that every senior and their families should know. First, let's understand what a stroke is. A stroke happens when blood flow to a part of the brain is interrupted, either by a blockage or by bleeding. When the brain doesn't get the oxygen and nutrients it needs, brain cells begin to die within minutes. This can lead to long-term disability or even be life-threatening. But here's the good news. Quick action saves lives. The faster someone gets medical care, the better their chances for recovery. That's why learning these early warning signs is so important. The first warning sign is sudden numbness or weakness, especially on one side of the body. Imagine you're sitting at the table, enjoying your morning coffee, and suddenly you feel a strange numbness in your arm, leg, or face. Maybe you notice that you can't grip your mug as tightly as before, or perhaps your smile feels lopsided. This sudden weakness or numbness, particularly if it affects only one side, is a classic sign of stroke. It happens because the part of your brain controlling those muscles isn't getting enough blood. Don't try to shake it off or wait for it to go away. If you experience this symptom, call emergency services right away. The second early warning sign is trouble speaking or understanding speech. You might be having a conversation, and suddenly your words don't come out right. They might sound slurred, or you can't find the words you want. Sometimes, people may not make sense, or they have trouble understanding what others are saying. This can be frightening, both for the person experiencing it and for those around them. If you or someone you know suddenly has trouble speaking or understanding, this could be a stroke, and it's time to get help immediately. The third warning sign is sudden confusion, trouble seeing or trouble understanding. This can show up in different ways. Maybe you suddenly can't remember where you are or what you were doing. Perhaps the world seems fuzzy, or you can't see out of one or both eyes. Sometimes, part of your vision just disappears, or you see double. These changes in vision or confusion can be easy to dismiss, but they are important clues that something serious is happening in your brain. If you notice these changes, don't ignore them. Get help now. The fourth early warning sign is sudden trouble walking, dizziness, or loss of balance and coordination. Picture yourself getting up from your chair, and suddenly the room seems to spin, or you find it hard to keep your balance. Maybe your legs feel weak, or you stumble for no reason. Some people describe it as the worst dizziness they've ever felt. This isn't just the regular dizziness that can come from standing up too quickly. When it comes on suddenly and is severe, it could be a sign of stroke. Acting fast can make all the difference. The fifth early warning sign is a sudden, severe headache with no known cause. This is especially important for people who don't usually get headaches. If you experience the worst headache of your life, and it comes on suddenly and without warning, it could mean that there is bleeding in your brain, a type of stroke called a hemorrhagic stroke. Don't try to tough it out or wait for it to pass. This is a medical emergency, and you need help right away. Let's review these 5 early warning signs of stroke together. 1. Sudden numbness or weakness, especially on one side of the body. 2. Sudden trouble speaking or understanding speech. 3. Sudden confusion, trouble seeing, or trouble understanding. 4. Sudden trouble walking, dizziness, or loss of balance and coordination. 5. Sudden severe headache with no known cause. Remember, strokes happen suddenly. The symptoms appear fast and can progress quickly. That's why doctors use the word sudden over and over when describing these warning signs. If you notice any of these symptoms in yourself or someone else, time is of the essence. Call emergency services right away. Don't drive yourself to the hospital. Let professionals take care of you from the very start. Now, let's talk about why acting quickly is so important. There is a saying in medicine, time is brain. This means that the longer a stroke goes untreated, the more brain cells are lost. But if you get to the hospital quickly, Doctors have powerful treatments that can sometimes reverse or reduce the effects of a stroke. For example, there are medications that can dissolve blood clots, but they have to be given within a few hours from the start of symptoms. Every minute counts. It's also important to share this information with your family, friends, and caregivers. Sometimes, a person having a stroke is not able to recognize the symptoms themselves. They may be confused or unable to speak. That's why it's so valuable for everyone around you to know these warning signs and what to do. A helpful way to remember the most common signs of a stroke is the acronym FAST. This stands for F. Face. Ask the person to smile. Does one side of the face droop? A. Arms. Ask the person to raise both arms. Does one arm drift downward? S. Speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T. Time. If you see any of these signs, it's time to call emergency services. Practicing this simple check can help you act quickly in a crisis. Even if you're not sure, it's always better to be safe and seek help. Delaying treatment can lead to permanent disability or even death. Some people might feel worried about causing a fuss or being embarrassed if it's a false alarm. But please remember, hospitals would much rather see you and find out everything is okay than have you wait at home and risk your health. Never take a chance with stroke symptoms. You might be wondering, what causes a stroke? There are two main types: ischemic stroke and hemorrhagic stroke. Ischemic strokes are the most common and happen when a blood clot blocks a blood vessel in the brain. Hemorrhagic strokes are less common and occur when a blood vessel in the brain bursts, causing bleeding. Both types are medical emergencies. There are also some risk factors that make strokes more likely. High blood pressure is the #1 risk factor for stroke. Other risks include diabetes, high cholesterol, heart disease, smoking, obesity, and a family history of stroke. Age is also a factor. Stroke risk increases as we get older. But no matter your risk, knowing the warning signs and acting quickly can make a huge difference. Let's talk about what you can do to lower your risk. Taking care of your overall health is the best way to protect yourself. This means managing high blood pressure, keeping your blood sugar and cholesterol in a healthy range, eating a balanced diet, staying active, and not smoking. Regular checkups with your doctor are also important. If you're prescribed medication for blood pressure, diabetes, or cholesterol, take it as directed. If you have questions or side effects, talk to your healthcare provider. They are there to help you find the right solution. Another important step is to know your numbers. Keep track of your blood pressure, cholesterol, and blood sugar. Write them down and bring them to your doctor appointments. This helps you and your doctor work together to keep your risk as low as possible. It's also a good idea to prepare for emergencies. Post emergency numbers by the phone or in an easy-to-find place. Let your family and friends know where to find them. If you live alone, consider a medical alert system or check in regularly with someone you trust. Being prepared can give you peace of mind and help you get help fast if you need it. Let's take a moment to remember that while stroke is serious, many people recover and continue to live full, happy lives. Rehabilitation and support can make a big difference, but the very best way to protect your health is by knowing the warning signs and acting fast. Sometimes the signs of stroke can be subtle or come and go. These are known as mini-strokes or transient ischemic attacks, TIAs. The symptoms may only last a few minutes, and you might feel better quickly. But a TIA is a serious warning that a bigger stroke could be coming soon. If you experience any stroke symptoms, even if they go away, call emergency services and see your doctor right away. It's also important to remember that stroke can look different in different people. While the 5 warning signs we talked about today are the most common, some people may have other symptoms, like sudden nausea, vomiting, or even fainting. Listen to your body and don't ignore anything that feels unusual or severe. Let's review what you can do today to protect yourself. First, talk to your doctor about your stroke risk. Discuss your blood pressure, cholesterol, diabetes, and other health conditions. Second, make healthy choices every day. Eat more fruits and vegetables. Choose whole grains, limit salt and sugar, and stay active in a way that's right for you. Third, Know the warning signs of stroke and review them with your family and friends. Remember the acronym FAST. Fourth, prepare for emergencies by keeping important numbers handy and making a plan. Fifth, don't wait if you notice symptoms. Trust your instincts and get help right away. Taking these simple steps can help you live a longer, healthier life. At Golden Age Health, we believe that every senior deserves to live with confidence and peace of mind. Knowing what to watch for and what to do is an important part of staying healthy as we age. You are not alone. Many people worry about stroke, but with the right knowledge and support, you can take control of your health. Talk openly with your friends and family about what you've learned today. Encourage each other to stay on top of doctor visits and healthy habits. When we look out for each other, we all become stronger. Let's finish with a message of hope. While stroke is a serious condition, recognizing the signs and acting quickly can save lives and reduce disability. Advances in medicine mean that more people than ever are surviving and thriving after stroke. Every day, people just like you are making healthy choices, learning new things, and enjoying life to the fullest. Remember, the 5 early warning signs of stroke are sudden numbness or weakness on one side of the body, trouble speaking or understanding, confusion or trouble seeing, loss of balance or dizziness, and a sudden severe headache. If you notice any of these signs, don't wait. Call for help right away. Thank you for taking the time to learn about this important topic. Share this knowledge with your loved ones. Together, we can help each other stay healthy, happy, and independent for years to come. Stay well, take care of yourself, and keep looking forward to all the good things ahead.